Dieting, exercise, you've tried it all. And the only thing you're losing is hope. Fortunately, Northwest Health System is here every step of the way. Supportive staff, an experienced doctor, life-changing results. It's time to meet the new you. We're eager to make the introduction. Call to make your reservation to attend a free seminar that could change your life.
And that's why we're talking about this, because fighting your weight's usually a never-ending battle for some. You exercise, eat right, you follow all the rules. So even if you have tried every diet in the book, doctors say don't give up. Dr. Josh Roller is a bariatric surgeon. He's here this morning with more for us. Thanks. It's good to see you again. How are you?
Very good. Thank you for having me.
Well, we are glad. Let's get right to it as we talk about bariatric surgery and exactly how it compares to diet. So lay it all straight for us.
Well, when we talk about bariatric surgery or weight loss surgery, it's for patients that are at least 60, 70 pounds overweight. And what we know from all the studies that have been done is that with weight loss surgery, you can lose between 60 to 80% of your excess weight. So if you're 100 pounds overweight, you could expect to lose 60 to 80 pounds fairly quickly over a 6 to 12 month period. For diets and non-surgical methods of weight loss, bottom line is it works for less than 5% of patients. And that's not a very good track record. They're also considered successful if they lose about 5% of their excess weight. So we're looking at 5% versus 60% and a track record of being 89% successful versus less than 5% successful.
Well, that is a really big difference. And again, you were saying this is not for everyone. Those that really qualify are people who have 60 to 70 extra pounds on them, correct?
Absolutely. And most of my patients have, in fact, all of them have tried other forms of trying to lose weight. It's a difficult disease, and this disease of obesity causes lots of other diseases: diabetes, high blood pressure, heart disease. And that's what we're trying to prevent and helping patients get healthier and back to their lives. So it's a life-changing step, and we ask our patients to be committed. But almost all of my patients have tried all of these other things and not had them work, and that's why they come to see us.
All right, so not only are they losing weight, but they are boosting their health, probably adding years to their life then. So let's talk about the different procedures and maybe what procedure qualifies for what patient. So what are they?
Well, so the three main procedures that are out there are, and I do all three of them using minimally invasive techniques. So 6 tiny little incisions and the cameras and the long instruments. But they're the laparoscopic Roux-en-Y gastric bypass. That's the traditional one. It's been out since 1967. And that involves making a small stomach pouch and doing some minor rerouting of the intestines so patients don't absorb as much. Weight loss is extremely fast, and it's the 60 to 80% of your excess weight. Patients do really well with this. In my experience, that they will lose that 60 to 80%. They do so in the first 6 to 12 months. And almost all, if not all of them, all their comorbid or other health conditions like diabetes, high blood pressure, and sleep apnea will not only get better, but usually go away. And we see diabetes in that operation go away in anywhere from 2 days to a couple months.
Wow, that is impressive. That's with gastric bypass, the number one. What's number two?
The laparoscopic sleeve gastrectomy. And this involves essentially removing the bigger part of the stomach and turning the stomach into a long, skinny tube. It also makes the stomach smaller, so patients feel full faster. And all these surgeries work that way. The other thing about the sleeve that's nice is the part of the stomach that we're taking out, it produces a hormone called ghrelin. It's one of the hormones that makes us feel hungry. When that's gone, patients feel less hungry. So not only is the stomach smaller and they feel full faster, they're also less hungry. And that's probably the main difference between surgery and diets, is that for my patients, they don't feel hungry after surgery, whereas patients who are just doing diet alone, they're constantly starving, and we all know about that.
Hunger is just part of it.
Absolutely.
All right, so that is the second one, the sleeve surgery for layman's terms, I guess. Give us number three.
The last one is the laparoscopic adjustable gastric band. There's a couple different bands out on the market, but this involves putting a band or a kind of a buckle around the top of the stomach with an inflatable balloon that can be adjusted to a different tightness. It allows food to go through or stay in the small pouch. and again, help patients feel hungry. Weight loss is a little bit less with this procedure, about 40 to 50%. It's slower over 2 to 3 years, but it can be highly effective for the right patient as well. It should note that these procedures, there's not one size or one shoe that fits everybody. And so these procedures are important because everybody comes to the table with different medical problems, different surgical histories, and it's up to an experienced bariatric surgeon to pick what procedure is going to be right for which patient. So it's very important that patients look at surgeons that do all 3 procedures, because if they don't, they very likely could get the wrong operation.
Well, that is why Dr. Roller will answer your questions and tell you which one of the 3 you were best suited for. If you have any questions for him, he's with Northwest Health Systems. They're on West Maple Avenue right there in Springdale. You can give them a call. Their toll-free number 800-734-2024, or you can just log on to northwesthealth.com. Dr. Roller, thanks so much. We will see you again.
All right, bye-bye.